PSC നേഴ്സിൻ്റെ പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. ഇത് പാർട്ട് 12 വീഡിയോയാണ്. കേരള DHS സ്റ്റാഫ് നഴ്സ് ഗ്രേഡ് 2 മെഡിക്കൽ സർജിക്കൽ ക്വസ്റ്റ്യൻസ് 500 മുതൽ 550 വരെയുള്ള ക്വസ്റ്റ്യൻസ് ഈ പാർട്ട് 12 വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. ഇതിനു മുമ്പ് ഉൾപ്പെടുത്തിയിരിക്കുന്ന പാർട്ടുകൾ കാണാൻ ശ്രമിക്കുക. അതിലും നിരവധി ക്വസ്റ്റ്യൻസ് ഉൾപ്പെടുത്തിയിട്ടുണ്ട്, പരീക്ഷയ്ക്ക് ചോദിക്കാൻ സാധ്യതയുള്ളത്. അവ പഠിക്കാൻ ശ്രമിക്കുക. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ നേരുന്നു. നമ്മൾ വീണ്ടും പ്രീവിയസ് ക്വസ്റ്റ്യൻ പേപ്പേഴ്സ് അപ്ലോഡ് ചെയ്യുന്നതാണ്. നമുക്ക് ഇന്നത്തെ വീഡിയോയിലേക്ക് കടക്കാം. Immunoglobulin increased during secondary response is dash. IgG. The first manifestation of bladder cancer occurring in 85% of all cases. Painless hematuria. Which type of chromosomal disorders are more common among males as compared to females? X-linked recessive. Most common cause of pharyngitis is beta hemolytic streptococci. Sports fracture related to tibia and fibula. Sports fracture is a fracture affecting one or both of the malleoli during activities such as landing from a jump, volleyball or basketball, or when rolling an angle. A certain amount of stress is placed on the tibia and fibula and the ankle joint. Malignant tumor of fibrous tissue is called dash. Fibrosarcoma. Purpose of giving myotics during narrow angle glaucoma is dash. Constriction of pupils. A client sustains a contusion of eyeball following a traumatic injury with blunt object, which intervention is initiated immediately. Apply ice to affected side. The elbow is dashed to the wrist. Proximal. Administration of medication in the eye is known as instillation. While caring for a postoperative patient of tonsillectomy and adenoidectomy, which action by the nurse is appropriate? Observe for swallowing patterns. During vaginitis, discharge from vagina become profuse and purulent. To evaluate the effectiveness of a client's pacemaker that provides on-demand pacing, the nurse ensures that the pulse remains dash equal to the pacemaker. The reabsorption of water from glomerular filtrate. The flow of water between the intracellular and interstitial compartments and the exchange of fluid between the plasma and interstitial fluid spaces are caused by osmosis. Earache is also known as otalgia. X-ray study of spinal subarachnoid space is termed as myelography. How to hold pinna in adult while observing the ear canal. Pulling the pinna up and back. Gold standard investigation for DVT. Venography. Commonly used diagnostics test for infertility among females is dash. Hysterosalpingogram. Which abnormal blood values would not be approved by dialysis treatment? Decreased hemoglobin. After cataract surgery, the nurse should notify the physician if the client is complaining of eye pain. Eye pain. Increased blood concentration of cortisol impairs tolerance to stressful situation. Vitals of postoperative patient is recorded as BP 90/56 mmHg, pulse rate 120 per minute, respiratory rate 25 per minute. What should be done first? Inform the surgeon. Most common complication that a nurse should notice to prevent total hip replacement. Most common complication that a nurse should notice to prevent following total hip replacement. DVT or deep vein thrombosis. Infection to deep layers of the dermis spreads along connective tissue planes termed as cellulitis. Bilirubin is a product of RBC breakdown. Pulsus paradoxus means more than 10 mmHg drop in systolic blood pressure during inspiratory cycle. Which specific preparation is needed before gastric analysis? RT insertion. Most important manifestations of chronic arterial occlusive disorders. Intermittent claudication and rest pain. Which foods should a client with leukemia avoid? Carrot sticks. The nurse is assessing a client for possible laryngeal nerve injury following thyroidectomy. Which action should the nurse implement on an hourly basis? Ask the client to speak. In which condition weight loss may not occur? Insulinoma. The shock that occurs due to hemorrhage and burn is known as hypovolemic shock. Unsteady gait is otherwise known as ataxia. When irritating an indwelling urinary catheter, the nurse should use sterile equipment and follow strict surgical asepsis. Classical example for a synovial joint with ball and socket. Variety dash shoulder joint. Which medication may cause complication with the treatment plan of a client with diabetes? Steroids. A patient with acute pancreatitis has NG tube for low intermittent suction to prevent pancreatic stimulation. 3 days after admission for a brain attack, client has a NG tube inserted and receiving continuous tube feedings. What should the nurse do to best evaluate whether the feeding is being absorbed? Aspirate for a residual volume. Amount of urine secreted per day by an adult is dash 1500 ml to 3000 ml per day. What is the classical signs of autonomic dysreflexia? What is the classical sign of autonomic dysreflexia? Hypotension and bradycardia. Organism responsible for pyogenic osteomyelitis is dash Staphylococcus aureus. Correct regarding tendon is dash it connect bone to muscle. What is the best reason for the nurse instructing the patient to rotate injection site for insulin? Lipodystrophic areas can result, causing erratic insulin absorption rates from these. When assessing a client with Cushing syndrome, the nurse would expect buffalo hump and hypertension. Shortly after admission to an acute care facility, a male with a seizure disorder develops status epilepticus. The physician orders diazepam or Valium 10 mg IV stat. How soon can the nurse administer a second dose of diazepam if needed and prescribed? In 10 to 15 minutes. The most important nursing action when caring for a patient with renal calculi is to increased fluid intake. What is the side effects of hormone medications and enzymes? Thromboembolic disorder. Painful extension of knee when the thigh is flexed at the hip and knee at 90-degree angle is known as painful extension of knee when the thigh is flexed at the hip and knee at 90-degree angle is known as positive kerning sign. An autoimmune disease in which an antibody mimics the action of TSH is dash. An autoimmune disease in which an antibody mimics the action of TSH is dash. Graves' disease. Graves' disease.
താങ്ക്സ് ഫോർ വാച്ചിങ്. PSC നേഴ്സിൻ്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC നേഴ്സ് എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.